Hello, Charlie.
Yeah, brother.
What's happening, man? How was your Thanksgiving, bro?
Nice and quiet. Nice and quiet. Got to call family, and everybody's doing fine. Everybody's doing fine.
Yeah, we had a great. We went to my brother's house. Very small get together. It was so funny when we got there. My brother's wife's family was there, sitting in a garage, all spaced out with masks. It was cool. It was nice to see that
Hmm.
people following the rules, and was actually really good. It was actually really really good to see that it's not just for the most part. I think people comply because they're afraid, especially the older people, especially the older residents that are afraid of this thing, and But it was really nice to just relax and unwind and have some really good food, and just enjoy family. My sister decided to stay at home. She's don't want to take a chance, but we was able to talk to my brother on a big island and my dad. It was all good. It was all good.
Oh,
So
that's good.
let me see what happened to my. Did you share it? Okay. Yeah, please. All right. Perfect. Hello, viewers. Thank you so much for joining us tonight. Um, we're just coming at you tonight. Obviously, the news just broke that the governor did approve our mayor's request for the opting out of the Safe Travels program effective December 2nd. So, effective December 2nd, uh, all Trans-Pacific arrivals will be subject to the 14-day quarantine. They will not have a testing option. So as I watch the comments today, uh, I see a lot of people that's very angry. I see a lot of people that are very happy. I think, you know, our mayor was put in a very tough spot as our numbers, as we all know, on Kauai has been quite alarming. The number of cases every day relating to travel was alarming. And remember, our mayor asked for a system or a protocol that would require a 3-day quarantine and then a second test, and it was rejected by the governor. The mayor asked a second time and never heard back. And the mayor, in my opinion, the mayor really didn't have a choice. He's trying to. I would have preferred mandatory. I would have want to see a mandatory 5-day quarantine or a 6-day quarantine with a second test. I know some people would still think that'll affect tourism. I understand that, um, but the mayor asked for even less. He asked for a 3-day mandatory quarantine second test, and the governor said no. So you put yourself in the mayor's shoes. He's watching these numbers come in. He's seeing our people get sick. He saw one of our residents die, and he just wants to keep our people safe. Now the quarantines, mandatory quarantine, mandatory second test, I think would have reduced the number of cases coming in. But again, the governor, in his words, in his own words, in his press conference, responding to a reporter, said that he would not support anything that would put further restrictions on the visitor. So it's kind of interesting. I didn't expect him to approve the mayor's request because of that statement that he made last week. It was just last week. So he did approve it. So December 2nd, starting December 2nd, any arrival will be forced to go through a 14-day quarantine. And I go back to what I say every night. I cannot imagine why anyone would want to travel for vacation during a pandemic. I don't know if you noticed, but today the CDC, and I'm not sure if it was today, it was relatively recently. I think it was today or maybe yesterday, but the CDC classified the entire United States of America, including Hawaii, as a very high risk travel destination. Very high risk, the highest level in their scale. And that is because of what's happening throughout the country. But these people that are from across the country are coming to Hawaii. And I think our mayor did what was responsible. I had hoped that the governor would have approved the mandatory quarantine with a test, but that is not the case. So again, effective December 2nd. Now that comes with consequences, as the mayor spoke at his press conference, and when he spoke on the TV, he said he realizes that that decision will come with uh, consequences, and that not everyone would be supportive. And he was absolutely right. There's a lot of people that are very angry, but what else is he left to do, Charlie? What else options does he have? He tried to go a route that I thought was very reasonable and practical, and the governor shut him down. We're not Honolulu. We don't have 8 hospitals on the island. We don't have, we have what we have. We have 9 ICU beds. That's it. And the lieutenant governor this morning in his thing with the Star Advertiser really downplayed Kauai. Really, really downplayed Kauai. He said that our numbers are very low. No one is no COVID patient is in an ICU bed. Our numbers are very low. But he would welcome our mayor's request. I mean, he thinks it's all right. But he also said, Charlie, and I don't know if you heard this. I shared it on my page, but he said that for those of us that are to not talk about wearing a mask and instead continue to talk about testing, he said it we're spinning our wheels and that we're insane. Those are his words, not mine. To continue to not talk about mask wearing, which we talk about mask wearing every single night, but to continue to focus, the way he put it was, he says, look, this interview has gone on 15 minutes and we've only talked about testing. We haven't spoken about masks. He said to continue to talk about testing without talking about the masks is insane. Well, I don't think I'm spinning my wheels, and I don't think we're insane, Charlie. I think that we care about this island. I think we care about our people. So does our mayor, and we supported him for that. We publicly supported the mayor's efforts. Now, I had hoped and I thought the governor was going to go with the mandatory quarantine second test, but that didn't happen. So anyway, that's kind of my opening.
Well, just there is no one up on the fifth floor that knows about negotiation, but it's what you gonna do. Like you throw out you throw out every single opportunity, 3 day, 4 day, 5 day, 2 day. You throw all of that out there, then and then the governor. And what's funny is the governor, like you said, would not want to inconvenience the the traveler. But what he did this time was to say, okay, you push me enough, we'll inconvenience the traveler, but at your expense. That's basically what he said. So, where does that put us? Well, all I can say is this: if that's how the governor negotiates, then you know what it's telling me? He never really looked at the numbers of infected cases. He didn't care about who was getting infected. He didn't care who came into Kauai infected. That's all it is in my books. He didn't look at the probability factors that we could right now we was rising, right? We're rising. It was bad enough supposedly the safe travels tests, right? Coming in, you get CVS opting out. Why? Why did they opt out? Because somebody asked me, and I said I'll tell you the reason why. And in digging more behind it, one, there's a surge going on in the continental U.S. Okay. Two, CVS was not able to turn around the 72-hour period with the amount of people testing to come into Hawaii. They wasn't able to get the test back before they left, so they just simply opted out. So what that tells me is this: if I was a betting guy, why would the lieutenant governor even attempt to talk to an entity like CVS and not put down some hard line parameters? If you're going to participate with the program, this is the commitment we need from you. So when the CVS Trans-Pacific travel, right, pre-testing was allowed. When was that? Back in October, right? CVS came
Mhm.
online supposedly as one of the first trusted tested partners, or trust, whatever you call it. And look at it now. It's November what today? November 27.
7.
Yeah,
Mhm.
27. Boom! They opt out already. That just doesn't make sense. So there. I know a lot of people are upset. Hey, you have every right to be, and I know a lot of people are happy, and you have every right to be. But all the mayor was doing is looking for keeping us safe, and he saw the numbers rising. Okay, we put this safe travels test. People were coming here to say, it won't come anyway. Okay, and they were given the benefit of the doubt. My test's gonna come. My test is gonna come in, and I guarantee you, it's gonna come in negative. Well, guess what? It didn't. But during that period of time, you landed. You weren't quarantined. You was walking around, and you could have got anybody infected. Okay, so
Mhm.
now we go back to the old adage, what we talked about before. Is the contact tracing profession enough to say where the virus came from? Does it lead back to a travel? No, because the only person that's being asked and they say, yeah, it's travel related, is the person who test result came back positive. What about the person that they came in contact with maybe 24 to 36 hours prior to that? Do they know who they came in contact with? Could that person have been infected? They gave them. But see, most of these tests that was happening, which that was negative to start with, or supposedly negative, but came back positive, they had already taken the tests. So that means that they jumped on the plane positive. They didn't get a positive test after they landed. That was not the case. And so that's why now the mayor is left with this decision. And there's no ifs, ands, or buts about it.
Yeah,
I
I
would,
think Dr. O'Carroll's report that he just came out with last week, um, I think it was very clear of the danger with the current practice. I think it was very clear that the data collected on Kauai, and I'm not talking about the statewide data because it's not accurate. No,
Mhm.
I listened to the lieutenant governor today, and he still relies on that inaccurate information. He still relies on that information taken from the Big Island on every passenger that landed. Now, some of those passengers had taken that second test that they took on the Big Island was within 12 or 18 hours of taking the first test. We heard Dr. O'Carroll's discussion, and so you can't use that data. That's not surveillance testing when you're testing upon arrival. The whole agreement or the understanding was that the surveillance testing was going to be done 4 days after they arrive, and the lieutenant governor quickly found out that that was almost impossible because visitors were not willing to give up their vacation time to go take a test that could possibly be positive, and then they would be confined to this state for 14 days. A lot of them got to go back home. They got to go to work. No, he should have known that. Should have known that. Who in the heck in their right mind was going to go take a test if they're not sick? But he's using those numbers to validate his. He talked about they tested 240,000 or whatever and had only 45 positives. Uh, Last week on Kauai alone, there was 53 cases since October 15th. So not sure where he gets his 43. I'm not sure. I don't know what the numbers are today. We had another two today. I think we had two yesterday. So, I'm sure we're probably very close to 65 or 70. I didn't, I should have got those numbers before I came on. But the bottom line is this: the numbers that the lieutenant governor posed on his pretty little whiteboard is flawed. And it's not accurate. It's not giving an accurate depiction of what's happening here in the state. And Dr. O'Carroll utilized the data from the only county that is actually keeping track, and not just keeping track on positives, but keeping track on active cases. Because as we know, If the person tested on the mainland and arrived on Kauai and got their results, like Charlie said, that guy was positive when he tested on the mainland. So the number of the positive case gets recorded on the in the state that he tested. And Kauai is the only place, the only county in our state that is counting or at least publicizing that number as an active case because yeah, we need to know the active cases on the island, not just the people that tested positive, because if you look at the state's numbers, it doesn't count the numbers of the positives that were tested on the mainland. So Kauai, when you look at the way Kauai reports, it's active cases. Whether they got the virus on the mainland and the virus is here, and that is that number of active cases. Now, going back to Dr. O'Carroll's paper, which if you haven't read it, you got to read it. It's on my page. Just go to my Facebook page and scroll until you find Dr. O'Carroll's report. It's very clear, based on the numbers that we have from Kauai, that the infectious rate, the number of people that get through the safe travel program is about 15 per thousand. That's the amount of people that are coming through that have not been caught and they're actually positive, versus the lieutenant governor's estimate of 1 in 1,000. That's a big difference. If you look at let's say Kauai, and just for discussion purposes, let's say we get 1,000 passengers a day. We get about 1,400, but let's just say for discussion we had 1,000. If you go by the lieutenant governor's theory, there's one per thousand. Well, we're getting 4 and 5 a day. If you go by Dr. O'Carroll's, anywhere between 8 and 15 or 9 and 15 or whatever it was, which is much more close to what's actually happening on Kauai. Actually happening, not theory, not whiteboards, not assumptions, but reality. This is what is happening, people, on Kauai. So when you take the numbers, the 1 in 1,000 versus the could be up to 15 per thousand, we could possibly have, if you think about 15 per day, we could have a few hundred positive visitors and returning residents running around the island carrying the virus. Now, we appreciate the local residents that go take a second test. We've picked up quite a few on the second test, on the voluntary test, but still only 16% of them are taking the test. And less than 2% are taking the test, the visitors that are coming to Kauai, less than 2% is taking that test. So 98% of the visitors that are around have not or will not take a test. What percentage of them are running around positive? We saw someone just post tonight, before I fired this baby up tonight, there was someone that said there were 2 flight attendants that had come into their restaurant or the restaurant, and they had sat down to have a couple of drinks. And they told the bartenders or the server that they were exempt from all quarantine. So they haven't been, she said, the one that posted said, the one flight attendant said she hadn't been tested in over a month. And she's flying around the country and gets to Hawaii, and they believe they're exempt from quarantine. Well, it's not true. They're exempt from, they have the modified, they should not be in a restaurant or a bar, but they are. And they haven't been tested in a month. And that is how this thing spreads. So, I'm torn because we have a lot of friends, Charlie, that work in the hotel industry. And Tyson just commented a few minutes ago, and he said, the governor should have just opted out from the beginning. And you know what? Tyson is right. Because if, in fact, the governor did what the mayor had originally asked, 3-day quarantine, mandatory second test, while it's not perfect, it's a hell of a lot better than what we have now, and the resorts could still function. But the governor rejected that. And because of the numbers rising and the number of cases here going on Kauai, and don't let the numbers fool you, and don't let the politicians that tell you what's going on Oahu fool you. Talk to a nurse. that works at Queens. Talk to a nurse. I wish we could get a nurse on here, but they are so afraid of retaliation and retribution. But it's a mess. The beds are filling up and they are overwhelmed and they are struggling, and it's happening across the country. Our frontline workers are beat up already. They're tired, they're exhausted. And I don't see how the mayor could have had another choice. I really can't.
Yep. It's a rough thing. While on a note, I like to again wish all of our viewers a happy Thanksgiving. I know it's one day after, but nevertheless, I got so much to be thankful for. All of you out there, thank you so much for joining us again. Hey, we ran a story a couple about a week ago now. Well, Saturday will make a week, right? Yeah, I think Saturday will make a week. We brought on an individual from that we talked about how he was discharged from the Queens and all the problems that he faced. And we're still working on it. But some of you have asked, oh, let's do a follow-up story to Nile, retired captain from HPD. And yes, we are going to do a story uh, follow-up, and it's not a pleasant one. It is not a pleasant story at all. And the reason why, same like that whistleblower that Jennifer, was it Jennifer Smith person? Mel, when
Yeah,
she
Jennifer.
she blew the story on the contact tracing, right?
Hmm.
Now, did they rehire her? My understanding is they rehired her after firing her, or is she
Well, they
still
didn't fire her; they suspended her. But I just
because
there was a short blurb of her coming back to work. That was it.
okay, but they suspended her because of what? Remember the story? And
Yeah,
it and something to do with firearms, right?
yeah, hostile work environment. She apparently had made a threat
Yeah.
to a fellow employee, and she mentioned the use of a firearm.
Okay. So that kind of raised a red flag. Well, when we bring now back on, all I can say is this: the whoever in the state decided to go on a full court press and made up some allegations now that in fact he made demands, this and that. And I followed up on some of the leads so far, and I can tell you the state is going into this deniability mode right now, and I can see why, because their so-called allegations of why. Um, well, put it this way: he started off with a COVID hotel, but he wanted a CPAP, right? So they take him to another hotel for monitoring. Now, get this: he goes to a dump, and they still didn't bring him the CPAP. It didn't make it didn't matter. Now, to get him back into a COVID hotel because he wanted to leave, they're making him sign all kind of paperwork, all uku piles, and I'm gonna try to get my hands on it, just so. And then they take him back to a confirm, and we saw the receipts. We got the booking number that the second hotel they acquiesced. We got all of that, only to be shunned from that hotel. Now, if what the state is saying is true, then let me ask you, state of Hawaii, then why did you allow him to go back to the first hotel after being out on the road for like streets for like 30 hours, soaking wet, and you allowed him to stay there in one COVID hotel under your guy's number, not his credit card, your guy's, where that's where he originally was, and all because he asked for a CPAP. Now we hear this kind of bull lie that, oh, you got to be at a medical observation when you use a CPAP machine. How many of you out there, ladies and gentlemen, use a CPAP right now? Do you have a nurse sleeping in bed with you while you get that mask on? No, right? So, it's that kind of stuff that, if you go make up one blue life story, make sure you know what you're doing. Make sure you know what you're doing. And like I said, there's more to follow up on, but that's pretty much the gist of what happened. And I feel bad because I felt it was a noteworthy story to let you know how someone who had contracted COVID was getting treated. And these guys came up and boss him up, boy, make this kind of allegation, these claims. And I said, man, that's not right. That's not right. So definitely we will bring Niall back on to do a follow-up story.
Yeah, I'd love to have him and the Department of Health boss on because I think right away the state got a little afraid, and they obviously didn't make any comments to the media because I'm sure
Yep.
their attorneys probably told them to shut your mouths because this is probably going to end up in court. But at some point you gotta be able to man up, own up, and say, hey, it was just a miscommunication. We screwed up, and we apologize uh, to Nile. I mean, that should have never happened, and we
Yep.
just we're gonna deal with it internally, and we will make sure that we'll hold the person accountable. That's how hard is that to do? And I think the frustration is when they come back and all of a sudden they're saying no, he's lying. Well,
Yep.
Charlie and I split up the investigation, and Charlie took the HPD side, I took the other side. Niles, all the non-police contacts, and they want to go to court. Let's go, because I think Nile is going to come out standing pretty damn tall and pretty damn rich. So if they want to go down that road and deny, they
Hmm.
might want to check because what we found is simply what we found is this: Nile was completely honest when he was on our show,
Hmm.
and that we can prove that. So um, whatever, man. You guys want to go down that road, state. Uh,
Should have not
that's
shouldn't have happened in the first place.
and I
Um,
wonder how many other cases like that we just don't know about that never surfaced. You gotta understand when you go file something against the government, it can be quite intimidating. It can you can and if you're on the senior citizen or kupuna, you most what most kupuna do, Charlie. They just say that's okay. It
mhm.
must have just been a misunderstanding. And that was Nile in the beginning. Nile, but he couldn't get the answers of why. Why did this happen? And Nile is now what he said on our show. He just doesn't want to see this happen to anybody else. And I probably think that it won't happen to anybody else after Nile came forward.
Mhm.
But how does something like that even happen? And again, like I said on the show, was that after 9 months, man, how can we allow this to happen? How can this happen? And you, imagine, for those of you that don't go back and watch that show again. You can go to my YouTube channel and you can just go. You'll see Niall's story. But imagine that's your kupuna, your grandma, grandpa, or your mom or dad, or your auntie or your uncle, or in some cases could be your son or daughter that had absolutely nowhere to go. And Niall being the nice guy, because Niall has family, obviously, has friends on Oahu, but he was sticking to the law, the rule that he had to quarantine, and he was not gonna put any of his friends or families in a position where he may still be contagious. He may still pass this virus. So he just didn't call anybody, and that just goes to the character of this guy. And it's just it baffled me when I found out that the state was basically saying he was making up stories. Uh, that
Well,
just that really upset me, really.
you know what is so disturbing is here we have a pandemic, right? We are trying to control it every which way we can, right? So you have someone under care and you have someone under quarantine. And once they develop the virus, you no longer quarantine, you in isolation, right? When he was taken to that medical so-called isolation center, that temporary quarantine isolation center in Ivale, and he saw the deplorable conditions, he wanted out. He wanted to go back, right?
Hmm.
So if you think about it, they originally took him there because of that CPAP. We're going through the CPAP because, and the reason why I bring it up all the time, because that's what triggered the move to that location. Okay. Then it always concerned me, why was he required to pay to go to another COVID location when there's CARES money that was used to reserve all these rooms? That's why in on Oahu, they got all these rooms that was paid for by CARES money. They talked about it before, right? They had the Heroes program. If you was working, I know there were some people from the prison guards uh, who tested positive that didn't want to go home and isolate to get their family infected. They got to go to some of the hotel locations and they got to stay there, but they didn't have to put down their credit card. Niall did. But then when I asked him, I said, hey, when you put down a credit card, what did they tell you this? Oh, liability. They said if I was willing to sign, and because I just wanted out, I won't sign whatever. I said, okay, I get that point. Okay, I can see that. So now, so they're telling you to go back to this place. Well, here's the thing that's strange, because we know that there was a caseworker assigned to him that also validated that he was going back to the hotel. That's where the thing gets jammed up. He on caseworker knowing that this guy just opted out. The state made him sign a declaration, right? Absolving of all liability. But guess what? He was on mandatory quarantine. So, it's almost like if Mel, by taking your son underage out to go drinking, you're contributing. First of all, you're endangering the welfare of a minor, right?
Hmm.
And yet you get a minor drinking. It's like you're contributing. Isn't the state contributing to the fact that he's in quarantine, but you're contributing to him breaking the quarantine. And then on top of that, you remember when he said he ordered his food, they're trying to figure things out. He left the lobby, but they said, oh, you cannot stay here. So he goes to the curb. You would think that hotel would call somebody and say, hey, we got quarantine violator. That's why we get quarantine couple breakers, right? That's now Dalera. He's not breaking quarantine. Did they do anything? No. They allowed him to walk from that location, which is located across the Hawaii Prince, if you know where that is, on Ala Moana Boulevard, right next to the trade winds, right? They allowed him to walk over to the Ala Moana Hotel. When that wasn't successful, he walked to Ala Moana Beach Park. Nobody from the DOH made it a point to go check, hey, where is this quarantine violator? You guys just let him walk. And you know what's even more worse? Because I had to ask him this because I replayed the tape again. I said, hey, Niall, when you were cleared, were you 100% clear from the hospital? He goes, Charlie, I still had pneumonia. So they let you out and you still had, he says, yeah, that's why I wanted the CPAP, but I still had pneumonia. And brother, you got all wet, yeah? How did that go? You go, oh, I was scared. And I'm not going to admit, I was scared. So that's the point I'm trying to make. I said, if you make up a story about this guy, you're contributing all the way around to making him actually going into that position that he had to take. You guys never do him any favors.
Yeah. It's like letting the drunk driver drive after he bail out, you know. Hey, brother, I'll go take you back to your car. You can go drive home now, knowing that he's a hazard to himself and others. In this case,
Yeah.
was the same thing that they let him walk out.
Yep.
And you know, if they had just taken him back to the Pearl,
Hmm.
where he already had his reservation, where he ended up staying
Anyway,
afterward,
for five
you know,
days,
after all of that,
finish out
yeah,
the quarantine.
after that ordeal in the park and in the rain, and they ended up taking him back. He ended up going right back to the Pearl because he had a state's reservation at the Pearl.
Yep.
But I understand what this is just what baffles me. So he wants the CPAP, so they got to take him to this dump. Now he never gets the CPAP. He's kind of under the Department of Healthcare because it's a directed quarantine. So, uh, but they let him go without the. He never got the CPAP. He never did. Never got the CPAP till today. He never got the CPAP. And I can see the state saying, okay, you want to leave these plush quarters of Ivile, then fine, you pay for your own hotel. Okay, all right. Giving them the benefit of the doubt. Say that's fine. We're providing you with this. If it's not good enough for you, you can go back. You can go stay at the Acquiesce and you can pay. Now, in my opinion, it is that social or that caseworker's responsibility to make sure that this patient gets into a facility, whether it's Acquiesce, whether it's the Pearl, I don't care, and don't just drop them off. Like you said, Charlie, we still don't know. We assume that he's not contagious, but we don't know. He's sick. He has pneumonia, but the Department of Health paid no attention or had no compassion. Just basically neglected him and said, "Hey, drop him off, brother. You're not even getting your CPAP." And that was it. And then from there, he had to fend for himself. And I don't know. Imagine, Charlie, you go online on your phone and you book your hotel, you pay with your credit card, you get your confirmation number, then you show up, and then the hotel says, "Sorry, we're not going to take you." Like Niall said, their reasoning was that there was a conflict with a third party vendor that provided these rooms for the state. I don't know how, that's one thing I didn't figure out. But regardless of what the issue was, he had paid, he had a confirmation number. That hotel should have taken him in.
You know
And we have all the documents that did occur. So
what's crazy about it is when we first found out what was coming down the pipe, it was said, "Oh, his credit card was no good." That's initially what was said. So if you look at that report, he had the presence of mind to say, "Hey, I better cancel my reservation," and it shows reservation confirmation number cancel. That means that they ran his credit card and they were already going to debit the 2,300 from the credit card. And then on the very bottom, it has booking number, and a booking number was issued. Now you cannot issue any of those numbers, confirmation or booking number, if your credit card no work.
well, the cancellation email that he got from
Yeah.
the booking authority or the booking company, it said the credit card was refunded, which means they already took the money.
Yep.
And they,
Exactly.
when after he canceled it, they had to refund the credit card. So
Yeah.
it wasn't just a hold. They had taken the money and they refunded the entire amount. So
Yeah.
again, I'm hoping that the Senate COVID committee, the House COVID committee, the Attorney General, I hope they look deep into this thing and find out exactly what happened. It's crazy,
Yeah.
but to allow him to walk out like you said is just insane, sane, just totally insane.
Yep.
Speaking of hotels, I did want to say because I see a lot of questions about the bubbles and on Kauai. There are 5 hotels and resorts that are participating in the bubble program. It's the Cliffs at Princeville, it's the Hilton Garden Inn, it's the Koakea, it's Kukuyula, and it's Timbers. Now, that list can grow. So, for those that are concerned about tourism, the hotels have an opportunity to get into the bubble program. Now, will our tourism numbers drop? Absolutely, we know that, and we knew that going in. If we had gone with a 5-day test, a 5-day quarantine, mandatory second test, yes, numbers would have dropped, but we would have kept our numbers very, very low, our COVID numbers. So the bubble really is where they can mingle around the property without having to leave the property, which makes it a little more attractive, I guess, for visitors planning a vacation, especially if your resort has amenities like a pool and a gym and all of that. The consequence and the downside of that is the employee safety. How do we assure our employees are safe because they will be working in a bubble with possibly, infected guests? So, but this is where the hotels now, Mufi Hanneman, step up, buddy. Rather than blasting everybody about, destroying tourism, let's go and do a concert, raise money, do what you got to do. Get these employees tested every 2 or 3 days. Um, Making sure that our employees are safe, making sure they have PPE, making sure that hotels have training programs. Hotels, have your corporate partners on the mainland drop some money down here so we can take care of employees and making sure that they are safe. The sanitization, disinfection, all of these things. I mean, you think about it, you could bring extra people on to work to make sure, like the gym, right? If you're going to open up that gym, set them up by appointment only. So, just one person or two people, whatever the safe, depending on the size of the hotel gym. And when they're done with their appointment time, the disinfection crew goes in and cleans it up and gets it ready for the next one. There are many things that can be done, considering we're going into a 14-day quarantine. But if I texted Tyson earlier today, I said, it's going to be a marketing issue now. How do you market your hotel or your resort as a very safe place that you can come and enjoy and not have to leave the property? So that might mean some live music that's in a location like on the front lawn that people can come out of lanai and listen to live music with obviously safeguards in place. Free, all the free things that you would normally charge for. You would be able to use for free. The amenities at the hotel, the all the movies, TV, whatever it might be. Provide free popcorn and soda for movies. I know this may sound corny. My point is that you can sit back and as far as the hotels that are not in the bubble and say, we're screwed, or you make the best of it and look for innovative ways to attract these tourists that'll be here. Yeah, they're not gonna be able to go to the canyon. Yeah, they're not gonna be able to go to K Beach. Yeah, they're not gonna be able to enjoy. But some of these properties have quite a few amenities that can be as attractive as well. So we're hoping that we can keep the majority of our hotel employees to work. But again, keeping them safe is much more important. Keeping them safe is much more important, and that is where I think these hotel executives, again, these corporate presidents and CEOs, you can chirp and complain and scream and cry, or you can be part of the solution and making sure that your properties on Kauai that participates in the bubble program, the resort bubble, which I thought was a genius thing from the beginning. I know a lot of people still think it's wrong. You know, that provides a safe environment for them and for the people. But again, our employees got to be priority. The safety of the employees got to be paramount.
I like to say, I'm just looking at some of the comments, please, gang. Um, I talked about Niles' case, and yes, he was from Lanai, and it ended up on Oahu. Just remember one thing: the hospitals are there to care for you when you're in distress. And one of those distress factors was he was having a hard time to breathe. Okay, and that's why he was kept in the hospital for X number of days until he was over that hurdle. But nevertheless, once you already have been tested positive on COVID, you need to weigh out the 14-day quarantine or isolation protocol. Okay. And that's the reason why they took him to a COVID hotel. He can only stay at a COVID hotel. Okay. So I just wanted you folks to know there wasn't nothing. I brought it up tonight because we had a really good show. He was able to explain his case, but then now there was a backlash of the case itself. And these everything that I just discussed with you now is post to that show. Okay, so I just wanted to let you folks know that. Another thing I wanted to talk about, Mel, was just um, looking at what direction do we go? And the reason why I'm saying this is, if anybody's going to start pointing fingers now, let me say this: the governor really didn't have to do anything. Everything was, some people said, there should be home rule. Each county have the right to whatever. Okay, what is troubling is that the governor didn't have to do anything. He just sit back and he just gives a thumbs up or thumbs down. That's all he got to do. He doesn't have to go into detail, but it's just that every mayor got to ask him. It's almost like, please, daddy, can I go outside and play? So basically, it would, please, governor, this is what we want to do. Okay. I would think any responsible governor would ask, why do you want to go that route? Why do you want to go down that route? And you engage in a dialogue. This route that Mayor Kawakami took, like Mel said earlier, he had no choice because all the options that was given before, without having any dialogue to talk about Mayor Kawakami, why are you asking for X number of days and second test? Never happened. Just say no, cannot. Okay. So Mayor Kawakami goes to step 2. In the meantime, the numbers start doing one of these, starts climbing up. Even the health officer was concerned. She came on. She told us she was just as concerned. Okay. So what happens? And so now, if Mayor Kawakami asks, I want to opt out, I would have thought, logically, I would have thought Governor Iggy would have said, why do you want to opt out? Are you saying that your island doesn't need the tourist help? With the economy, what is it? It seems like, I mean, we don't have all the information, but it seems like everybody just sat on their duffs. I just say, okay, you want out? Fine, I give you the opt out. But again, it goes completely against what he said before, and that is he was not going to do anything that would inconvenience any of the travelers. But this totally does accomplish that. So that's why I said there's always kind of mixed messages. And
Remember, the mayor asked for the 3-day quarantine, and I said this earlier.
we
And
break
for
that.
those of you that came on later, I see some of the comments. It's you may have come on after we had shared that, but the mayor came and asked for the 3-day quarantine mandatory second test. That got outright rejected. The mayor again asked to revisit that just a week or so ago, and the governor was asked on the TV news about are you inclined to support Mayor Kawakami's, and he said no, that he wasn't, because again he was not going to he wasn't going to approve any more restrictions on the visitors. And in the meantime, as Charlie was just saying, the numbers keep rising, and I think people got to understand 9 ICU beds is a very dangerous place to be, and it's a tough call, but the way the numbers are rising, the way the we are seeing this now into community spread, that's the dangerous part. That was the part that the mayor and his team and Dr. Behrman, who wrote that letter, Dr. Behrman wrote a letter independent of our mayor asking the governor to put up a temporary stoppage of the Safe Travels program for the month of December because she was afraid. Remember, she's the state health director for Kauai. She has worked through pandemics. She's seen what these pandemics do in communities, and the idea was to stop the infections from going to the community. And the way you do that, obviously, is you isolate the virus, and if it's visitors, you keep them in confined spaces. And you cannot do that when you have people coming across with a one test system before they board that plane. And even if it's negative, we've had enough cases on Kauai where passengers came across with that negative test and either got sick or had reason to be tested and tested positive. So again, I see no other option that the mayor had at this point. Either or let it roll. Just let it roll and watch the beds fill up. And then you see the thing about this mandatory quarantine doesn't create a lockdown. The local residents are free to move around and free to the businesses are able to stay open. I understand a lot of the business rely on tourism and that's going to be affected. And that's one of the consequences I think the mayor talked about when he put forward this request for the quarantine. But where's the balance? Where's the balance when you have, I think when Kauai saw its first death, or actually it was our second death, first one on the island though. I think it drove a lot of it became real for a lot of people, especially the people that knew that person. And I see the question: why didn't we get more beds? The beds is a physical asset. The bed itself. The problem we have is personnel. We and that's the trouble. I mean, that's the problem statewide. Is you could build a MASH hospital outside of Wilcox, but who's gonna man it? Where's your ICU nurses gonna come from? Remember, ICU requires a constant care. That's the problem that the states, the mainland United States, are seeing right now. Is where they would typically borrow resources from neighboring counties and states. That's not available anymore because there's none around, and that is the issue. I mean, we have 9 beds. You could put up 20 beds, but if you don't have anybody to staff those beds, then that's it's useless. So and from what the people that I've spoken to in the hospital in the hospital industry and in the medical industry, that's the concern. And that's why I think and that's why I support my mayor's decision is because he's not going to wait for us to fill up the beds and then have to decide who lives and who dies like many of the states on the mainland. And I think people got to understand that it's not the beds, it's not the number of beds. I know a lot of people say, hey, just why we never build more beds? Well, you could build beds, but you don't have the medical personnel to staff the beds. You don't have people. Our staffing, our medical staffing right now is stretched so far and so thin. On Oahu, they're flying nurses in to just give some breaks to our nurses. So yeah, it's not just about the bed. My gosh, CARES monies, you could buy beds. You get a bed, you get all the machines. Yeah, that can be bought. We just don't have the personnel. We don't have the personnel to run it. And that is, I think, the reality that a lot of people aren't haven't are not seeing. But if you talk to the ones talk to anyone at Queens. If you know anyone at Queens, I'm not mentioning names, but there's people at Queens that are from Kauai that have shared with me what's going on, and it's scary. And I feel for these nurses that they see these deaths every day. 2 deaths, 3 deaths, and the problem I think, Charlie, that a lot of us have is we see the numbers compared to the mainland, but when you're a nurse or a doctor and 3 people died on your watch in that last shift, in the last 24-hour period, 3 more people that you have worked on, it takes a toll. And it's difficult to visualize that because when you hear, oh yeah, in the mainland, there's thousands of people died today, thousands, yeah, and it's spread across a huge area. But when you're talking about 3 people that are dying in a hospital on Oahu, think about that. Think about you going to work and changing your shift, and you're the person you're relieving saying, hey, man, we lost another one. We lost two. Hey, we lost three today. So it's not just the ICU beds. It's the personnel. It's the
Yep.
personnel.
Yep. You know, I can say with some certainty that um, for the hospitals I've been involved with, because because of the security program that we provide, I know the number of beds at the hospital, and I've seen them when they do get occupied, and I've seen how things can get a little hectic. So when you're talking about the entire island, then you got to make some real critical decisions whether you keep them on island or if you can afford to medevac them to Oahu, and hopefully there's a bed available on Oahu. But again, if that happens, we also it's like the NFL draft. You're looking for that valuable piece of real estate, right? You're looking for that valuable piece of real estate, and you got to hope that there's enough for not only COVID patients, but patients who may suffer a heart attack, patients who may suffer a stroke, patients who suffer from COPD, anything that requires intensive care intervention. They're going to be vying for that same piece of property. Okay. And if we add on to the mix by not being careful enough, then the question remains, who makes a decision to play God? Who says we'll take you? You're gonna have to wait in the hallway. You know, how do they categorize that? I don't know. But that's a question that I know is gonna be asked. If they see your loved one in the hallway and not taken into an ICU room, in fact, you can't even go over there to be with them. But if you find out later that, oh, they never made it to an ICU, well, how come? Two came in at the same time. Your loved one was weighed out against someone else. And we had to look at which one, I mean, I hate to put it so bluntly, but which one had a better chance of saving. That's what's going to happen. And nobody wants to be in that position, gang. Nobody, nobody. But
I can
if we continue to go down this slippery slope, it's going to get to that point. And I think that's what um, everyone has been warning. Do not fill up our beds, as much as possible. If we can stay safe, use the beds as needed. But if you go and just goof off and do whatever you want to do and you get sick or you get tagged by this thing, it's tough. But somebody's going to have to make that decision.
I don't know if you've ever, when my mom was still alive, and she would have would frequent visits to the ER, and we would be waiting there, and my mom would be and definitely needed to go upstairs, and I can remember at least three times where they would come in and they said, we just don't have any rooms available right now.
Hmm.
We don't have any rooms, and my mom needed some advanced care, and we'd sit there, my brother, my sister, myself, and we'd sit in that room, and I would get upset, like, what do you mean there's no rooms? There's no rooms. There's no rooms available. And thank God it wasn't any life threatening diseases or situations, but nonetheless, trying to treat someone that should be in an ICU bed in an emergency room because they don't have a room available, a bed. And back then I didn't realize that we only had 9 beds on the island. Honestly, Charlie, I when I heard we only had 9, now it makes sense to me why they couldn't put my mom up there, because there were other patients that were in more serious shape and that needed the ICU.
Hmm.
But I wonder how many people actually die in emergency rooms because they don't have enough beds. And we hear the horror stories. And I don't know why we would have to wait until that point before we start taking, you know, for the most part, the state has been very reactive, right? Remember in the beginning, cases started to rise. It was still very low. We shut the state down. And then we you know, we kind of opened up. And then as the cases started to rise up again, we opened up. We're so reactive.
No,
And
we
right
backwards.
now,
We
and
backwards.
you know, and then now we have Kauai, who I believe, thanks, you know, to again to Merkel Kame and his team, trying to be proactive. We don't want to get to that point where, oh, you know, we have three COVID patients in ICU. We have four COVID patients in ICU. We have two or three non-COVID patients in ICU. We only have two more beds left. But the fact is, by the time you get to that point, the number of sick people in the community is going to be more than we can handle. Going to be more than we can handle. And then when that next patient goes into ICU, when that next patient goes into ICU, then what happens to that third patient afterwards, where there is no ICU bed? What do you do? What do you do? So yeah, I understand the frustration and the anger for our hotel industry, and I really feel for them. But you know, this now is the time. The governor, you know, rather than talk nonsense about what you're going to do with that CARES money that you haven't spent, and we have a little over a month to spend it. Now is the time you got to put that money in the people's hands that need the help. Now is the time to do that. And I'm not talking about one $500 restaurant card. I'm talking about some real meaningful unemployment and stuff that some of these guys have never gotten paid. That is what, that's the next phase it is. Prevention is the key. And I appreciate our proactive government here on Kauai, because I think we're going to save a lot of lives, but we're going to affect a lot of people financially. And that's where the state needs to, hey, take out your checkbook and start writing them checks, because people need the help. People need the help. So that is that's my take on this now, Governor. Okay, fine. So we are moving in this direction. We know some people are gonna get affected. And I'm talking about the ones that are truly being affected. Um, those are the ones that needs the assistance, and they need it now, and the state needs to release those funds. That's just the way it works.
Well,
Just trying to read.
well, it's there's so many. I don't want to say there's so many things happening, but it seems like it. Um, I am certain that I would not be surprised if the governor comes off his position. I mean, I'm just hyper speculating that he comes off his position and thinks that ask if we could have a second test, because I've always been one that's saying second test is always good. Second test is always good, but don't throw away money on foolish tests, right? Well, why put on tests when the thing's so close together that it don't mean nothing? Spread them apart. And Dr. O'Carroll did a fantastic job explaining in layman's terms why it has to be so many days after, because he understands this virus. He understands about incubation. And, I did a post that actually said, our lieutenant governor is a medical doctor, okay, emergency room physician. If he wasn't an emergency room physician, would he be in charge of this battle against COVID? Probably not. Probably not. But because he's an emergency room physician, he's in charge. I would have wanted to see someone with a little bit more expertise in the field of epidemiology to head this program, because they know what they'll be looking at. Okay. And you know what was so ironic? I watched the show Designated Survivor. Okay. And there was one episode that talked about the spread of this virus and how an epidemiologist was the one that solved it because they knew how to attack it. It wasn't a regular doctor. But it is what it is, right? No, it is what it is.
There were many options to, I mean, you would want an epidemiologist. You would want someone that has had experience in a pandemic. I think really that would be ideal. Someone posted, and it made a lot of sense that, emergency room doctors, bless their hearts, because trust me, when our son was little, we also spent a lot of time in the ER. But they deal with reaction, right? You don't go into ER to tell, hey doc, I'm starting to feel sick, or I'm concerned because my neighbor is sick. No, you go to the ER after you cut yourself, after you did something really bad, or you got into a car accident, or you had a heart attack, and now the ER staff is there to put you back together after the fact. And I think that's where we went down the wrong road, where we're focusing on what can happen after you get the COVID virus. Don't we can take care of you when you get the COVID virus. When in reality, we should be doing what Kauai is doing and saying, hey, let's not get the virus. Let's stop the virus. We don't want to fill up our hospitals. We don't want to test our doctors and our nurses. We want to prevent the virus from spreading, and as opposed to dealing with the virus after it's too late. And I think that's the direction we've headed. And I think
Yep.
Kawhi is the only one that has actually stood up and said, and knowing very well that it was going to come with some very harsh criticism from the hotel industry, well, I should say the visitor industry, because that entails everybody, entails all of the sightseeing, the tours, the boat tours, the helicopter, all these people are going to be affected. So it's tough for the mayor to make that call. But I think when you put everything down on paper,
Hmm.
when you look at the facts and the data that Dr. Carroll put out, when you look at what's happening in other places like Kauai, remember, I'll never forget when we had what's the doctor's name from Utah, um,
Kimball.
Kimball.
Yeah.
I'll never forget when he said 2 weeks ago we were just like Hawaii. Remember that, Charlie, when he said that? I remember like it was yesterday. Can't
Yep.
remember his name, but I remember what he said. 2 weeks ago we were just like Hawaii, and now we're maxed out. We're at capacity. People are dying. I'll never forget. I'll never forget that. And I think it can happen that quick. And when you don't have the overflow, when you don't have that opportunity to borrow resources, what the hell do you do? I mean, what do you do? Sorry, we leave you in a waiting room until we get one, until somebody else dies, so we can go clean up the room and put you inside. I think that kind of thinking is dangerous, rather than let's suffer short term. I remember, Charlie. Remember that all the people were saying, all the experts were saying, we open up October 15th with one test. That uh, boost to the economy is going to be short lived. That's exactly what they
Well,
said.
I tell you one thing now. The only thing I'm angered at, with the vast knowledge of expertise that we brought on this show, as well as those that remain out there who publish medical reviews that actually um, know what the heck is going on. I am frustrated that it almost as if uh, our state felt, we know more than them. And that's the thing that frustrates me the most. I mean, you get like Dr. O'Carroll, you get Dr. Kimball, you get Luke, not Luke, but the father Lee, Evslin. You get our good friend Murtaza, right? You get Deworkin. You get all these individuals who deal with. I mean, here you get a guy like O'Carroll, okay, pretty plain, and you can say, well, he's an ER doctor. But how many ER doctors have been asked? to be a consultant to a Netflix series entitled Pandemic. I know the lieutenant governor wasn't on there. So, you know, when you get people like this, I think when they say something, there's a lot of weight behind it. You know what I'm saying? There's a lot of weight. And for a state not to even move, not even a smidget on what they said, that's very, very frustrating. So now let me take you one step further. When everything was going on with Honolulu, you had two state epidemiologists. One was Dr. Berriman helping out with Honolulu, and Mayor Caldwell recognized her. Then Kauai, we're fortunate to have Dr. Berriman as our health officer. Then on Maui County, you have Dr. Lauren Pang, and I forget the gentleman's name, and I knew I was getting myself into trouble. But on the Big Island. But can you tell me, out of all of them, how many of them have been in pandemics before? We know Dr. Berriman has because that was part of her intro, right? The first time we brought her on.
Mm-hmm.
She was involved. I mean, she wasn't in Hawaii. She was where the hot zone. She was where the action was happening. So he gets somebody. We're very fortunate to have somebody with that background. So therefore, I truly believe that what she has consulted the mayor and advised the mayor, she saw something very serious is about to happen. And based on what we have on Kauai, she knows that if we couldn't control it in time, things will get pretty bad. So again, this thing that the governor signed that approved doesn't take effect to December 2nd. So ladies and gentlemen, all I can say is anything is possible from now until December 2nd. But I would caution everyone right now, the thing we have to watch for is the numbers that are released by Kauai County. Keep an eye on that because that will tell us how this virus is working here on our island. That'll be the most important. That's what I would be looking forward to. Where this virus is and what it's doing. Hey, brother?
Well, thank you very much, Charlie. It's 8 o'clock. Appreciate you guys all joining us tonight, having this discussion. This was pretty much unplanned because we didn't realize the governor was going to announce or approve Mayor Kawakami's request. We go forward from here. You know, I got to say again that it's not just the tourists, it's not just the visitors, it's not just the travelers, it's each and every one of us.
Mhm.
And, you know, some days I feel like taking pictures of some of our local residents doing what they shouldn't be doing, post them on Facebook, but I'm not going to do that. I just not going to do that. Um, it's we coming up in the holiday season, and I know the temptations to get together and I've been hearing a lot. I've been getting a lot, and I mean this, a lot of complaints or questions from people about churches, that the churches are opening up again, no masks, no social distancing, singing. People, the fact that you're in a church doesn't make you immune from this virus. We got to be smarter. And I'm talking to the local people, I'm talking to the residents. We got to be smarter. You got to wear your mask. You got to social distance. You got to disinfect. You got to do everything we need to do. You got to avoid gatherings because we are part of the problem when we're not following the rules. And
Yep.
I am starting to see so many of our local people get complacent again. I'm seeing so many people at gatherings on the side of the road in parking lots. I see them at the beach. I'm on the road during the day. I had to go to the west side today. You know, Waimea Town, I see the local residents hanging out in groups, no masks. So while it's convenient and sometimes for some people, fun to pick on the tourists. Guys, we better look at ourselves first. We better start following the rules because in a couple of weeks, actually, no, in 1 week, you ain't gonna get tourists to blame. And we gotta start doing them ourselves. We gotta take care of. We say this every night, but I can see the complacency as I drive around this island, and I'm taking the complaints from people. So you know, guys, let's do it right. Let's make this quarantine period a short one. Let's make it a short. We control that. We control it.
Yeah.
That's what I got to say. Charles, anything before we head out?
Yeah, I like to apologize, and I said, we still get some time. I don't know what made me think that this was October and we get December 2nd. We got a big gap. But I forget this is November.
That's
Like
right,
on
bro.
like on Lolo. So I apologize. You know, if I came across very somber tonight, I just never like go bashing away at, at things because no use put anybody on a defense, no use put anybody in with blah mood. I want to take this opportunity to thank all of you for sending me messages, thanking me for the jokes that I put a ton load of jokes on my post today. Mrs. Iona said, "Hey, knock it off." I said, "Honey, put a smile on somebody's face. That's the key." So I just want to say thank you for all your messages. But like Mel said, if we keep it, and you've heard me say this before, if we keep the corridor tight, there's a lot of things we can control. Okay. If we leave the floodgates wide open, what will hurt us is the unknown. And then the only way anybody gonna find out what the hell is going on is when those numbers start to rise and you see people getting sick. And that's not where you want to be. It's too late already. We don't want to get to that point. You want to stop it before it even gets there. And that's the key behind this whole thing. That's the key behind this whole thing. So gang, I want you to have a great weekend. We'll be on tomorrow night, Saturday. I love you all. Please take care. And again, we got so much to be thankful for. Let's not lose our opportunity right now. Let's just uh, hang tight, and I'm sure everything will work out. Let's just hope for the best. Hell,
Absolutely. See, Charlie does the nice. I love you, and I'm telling everybody wear your damn mask. I'll be the bad guy. I mean that with all my heart, though. I mean, we can control. We're gonna see the numbers from Thanksgiving. We're gonna see the numbers in about probably 2 weeks. We'll see how many God forbid how many cases. But
mm,
I just want to say, guys, I know for those of you that are frustrated with the mayor's decision, I empathize with you. But I got to tell you, man, I'm just going to close out with saying that, I support the mayor's decision. I also think that, again, the state needs to step up and fix their stinking unemployment program and get these people paid. But right now, it's about cutting off this virus so we can go back to where we need to be. And that is only going to happen. That is only going to happen if we be responsible ourselves. I hate to repeat myself, but I feel like I have to because tomorrow we'll drive out on the road and we'll see our local people again. So be safe, guys. Think of the others. Think of those that are struggling, are less fortunate. Let's get them back to work as soon as possible. All right. We love
free
you guys.
testing,
God
right?
bless. We'll see you guys. We'll see you guys tomorrow night.
Free testing, right? Tomorrow. Okay.
Oh, tomorrow, Kekaha.
Yeah, free testing.
Free testing, guys. This is for Kekaha residents. This is for, and thank you, Charlie, for bringing that up. The free testing tomorrow at Kekaha is only for the Kekaha residents because obviously there's some cases out in Kekaha. Sunday is the free testing for everybody. And I believe it's at Vidina Stadium on Sunday. I
Hmm.
could be wrong, but you can go to doineedacovid19test.com. Do I need a COVID test do I need a COVID-19 test.com. Make your appointment for Sunday. Kekaha residents, tomorrow's one is for you. Okay, thanks for bringing that up. All right, guys, take care. We see you guys tomorrow night. Love you guys. God bless. Aloha.